Namaste and hello to everybody. Now the day is of yoga and pranayama. So everybody knows the name of Kapalabhati. Kapalabhati is one among the important pranayamas. Pranayama is nothing but yasmin sati shwasa prashwasa yorgatir vichedaha pranayamaha. That is the most secret type of breathing technique which has been mentioned by our ancient gurus and sages and rishis is known as pranayama. Kapalabhati is one among them. The meaning of Kapalabhati is Kapala is the forehead, Bhati is nothing but shining. If you want to have the shining look like very healthy, you have to practice Kapalabhati. Now we'll see how Kapalabhati is practiced. Now you came to know the meaning of Kapalabhati. So let us practice what Kapalabhati is and how to do it. See, for any pranayama, we should keep a fixed asana. Here, we will do Sukhasana, folding our legs very easily, or else Siddhasana, keeping the left leg like this and right leg over this. But very, very importantly, our backbone should be very straight. Those which has got Shat chakras, we should keep it in a single line. That is very, very important. If you want to get a good result, you have to keep your back straight. Okay, now we will do Kapalabhati Pranayama. The procedure here is throwing the air out continuously through the nostrils at the rate of 1 stroke per second. Here we close our mouth and expelling air forcefully through the nostrils continuously without break, that which makes our body tejomaya. See, now keeping the Stiram Sukham Asana, any Siddha Asana or Sukha Asana, those who can practice Padmasana, for them Padmasana or Vajrasana, any suitable asana can be done. Then we should keep the mudra. There are several types of mudras are there. Here initially we will do Dhyana Mudra or Jnana Mudra. Then very easily we have to close our eyes, close our mouth, then expel the air at the rate of 1 stroke per second without making any hyper expressions in the face, like with a little smiley face. This can be continuously for initially 30 times, 60 times, 90 times, 120 times. Likewise, in a minute, one should do this Kapalabhati for the 60 times, means 1 second, 1 Kapalabhati. In the same way, if a person is able to do continuously for 3 minutes, he will do 180 expels. If he is able to do 5 minutes, it will be 300 Kapalabhatis. See, just simply I will explain how to do. For example, imagine that there is dust particle over this your palm. Now, if you want to blow it with the mouth, you will do like this. Like this. At that time, if you keep one hand over the abdomen, you can feel that your abdomen is jumping without your knowledge. See. Without our knowledge, the abdomen is jumping and pushing the lungs to expel the air out. In the same way, here in Kapalabhati, we are expelling through the nostril, not from the mouth. Now close the mouth and expel and blow this air, blow this dust. In the same way, continuing in Kapalabhati. Like this. See, the thing here we should make out that the sound may be different from person to person. The speed, the shape may be different from person to person. So that is why Those who have very strong lungs, they can do it for long time, like 5 minutes, 10 minutes likewise. That is why this is very, very important. Now we'll see the wrong way of doing Kapalabhati. Now the improper or the wrong way of doing Kapalabhati. For example, some may do Kapalabhati like this with the different expressions in the face. If they do like this, then it will be wrong. Like this. If they move their eyelids or they move the face, that will be a wrong projection. For example, some will do with them moving their shoulders up. This is also wrong. And another wrong they will do by bending their back. If they do like this, it is also wrong Kapalabhati. This is also wrong Kapalabhati. So that is why always we have to keep our back straight, close our eyes, hold the mudras, any Dhyana mudra, Vata mudra, or Apana mudra, or Varuna mudra, Apana Vayu mudra, or Hridaya mudra, Varuna mudra. Likewise, several types of mudras are there. Initially, the person can practice with the Dhyana mudra, keeping last 3 fingers straight and touching the tip of index finger and thumb finger. It has got lot of tattvas of Panchamahabhut. That is why this is very, very important to practice with the mudra. The pranayama will be very effective. See, once again, we will do the proper Kapalabhati. Slowly we can stop. Then at the end we can rub both the hands. The tejas or the charges which are accumulated at the palm, we can keep it over the closed eyes, and slowly if you open, we will become very fresh and energetic and enthusiastic. That is why Kapalabhati. Kapalabhati is nothing but Kapala means forehead, Bhati means shining. The person who is practicing this continuously will have a very healthy features. He will appear very healthy and very handsome or beautiful like. Now you have the doubt. Can anybody practice Kapalabhati at all the time? Yes, anybody can do. But very, very important thing we should keep in mind that if you had a full meals, then after 4 hours of the meals you can do this. If you had snacks or light food, after 2 hours you can do it. If you had juice or milk or anything, then after 1 hour you can do this. If you consume water, after half an hour you can do this. One thing. Another thing, the patients who are suffering from hypertension or BP, blood pressure, if it is under not control, then one should not practice this very fastly. Number one. If their BP is under good control, if they are on medication, if they had very good sleep earlier night, then also they can do it. But if they had no good sleep earlier night, or if they are having a headache or symptoms of giddiness of BP or anything, they are not supposed to do this. The persons who had the abdominal surgery or any cardiac surgery or eye surgery, any surgery, minimum 3 to 6 months they are not supposed to do this Kapalabhati, because while doing this Kapalabhati, the intra-abdominal pressure will increase. So that should not cause any problem to them. Then particularly those who have got fever or those who have got are not feeling very well, for them also it is contraindicated. And ladies with the during menstrual period, or pregnant ladies, or after delivery, post-delivery periods, these cannot be practiced very easily. That is why better to avoid Kapalabhati after these periods. Now, interesting thing, what are the uses of Kapalabhati? If you come to know the benefits of Kapalabhati, definitely you will start this immediately, because those who want to gain weight or those who want to lose weight, for both of them this Kapalabhati is very effective, because those who want to gain weight all the systems will become very active. Their digestive system will become very active, so that whatever they consume, it will get digested. They will get good digestion. They will get good sleep. Their muscularity will develop. So they will have a very good weight. In the same way, those who are obese, for them, in each and every Kapalabhati, we are spilling the water or fluid 1 gram per stroke, just like it's an artificial sneezing, like akshi, like this. So that is why while doing Kapalabhati, particularly nearly half to 1 gram of water is expelled from the body, excess water is expelled. The heavy toxins also removed from the body. So automatically they will become very proper weight. That is why for obesity also it's very important. The person suffering from constipation, arthritis, diabetes, hyperlipidemia or cholesterol, or for BP also, those who have BP, if they are doing this in the normal BP condition, the BP also get cured. Then indigestion, sleeplessness, migraine, and particularly the persons who are suffering from the cancer also. Because cancer is nothing but uncontrolled cell growth. Neoplasia is nothing but uncontrolled cell growth. By doing this Kapalabhati, it have the effect like just like it promotes if they are taking chemotherapy or radiation also, if they do Kapalabhati, the results of this radiation or chemotherapy also will be increased. There are several tests has been made, and particularly for infertility or PCOD problem, obesity, and all intra-abdominal problems can be cured. Prostate and arthritis and psoriasis, all types of skin disorders, particularly those who have hair loss or sight problem, eyesight problem, or any particularly we can't mention disease wise. Totally it helps a lot, but we should take care that who or for whom this is contraindicated. By knowing this only, we should do this. So that's why Kapalabhati, we have several types of pranayamas, but knowing it promptly and doing it holistically and practicing it holistically is very important. Start Kapalabhati now itself. Dhanyavad.